My name's Connor, I'm a dentist in Cumbernauld. What made me enrol in Identity's orthodontic training was I knew Andrew. So Andrew basically owns one of the practices that's local to us, and I'd referred to him for a long time. And then he reached out to me saying, would you like to come and basically come to the open night? So we went to the open night, they explained kind of how the course works. How the course works is you do some of the training, then they've got an open forum. With the forum, you can basically put up your orthodontic assessment, get some opinions and some treatment plans, then to present it to your patient confidently. And when the patient has then had a chance to think about it, then you can go ahead with treatment, which basically makes it much easier for me because I'm a lot more confident going forward to the patient with these treatment options, and the patient is more confident that the treatment is actually appropriate. So what I've gained from the programme is basically a lot of obviously knowledge just from the basics of orthodontics. We get some teaching at undergrad, but this one's kind of more on fixed. They do just give you more mechanics, but on fixed orthodontics, it's pretty much just like this is how it works and this is what you need to watch out for, which is actually a big part of it, like unwanted tooth movement. And from that, kind of coming up with treatment plans and just knowing the red flags to look for, and basically anything that you really need to watch out for. Then that allows you to do a proper assessment, put it forward to the forum, and then basically get the feedback that you can go ahead with to start treatment. The aspect of training that's been the most valuable by far is the open forum. The open forum, it kind of forces you to sit down and do your orthodontic assessments because when you put up pictures, you're expected to have an orthodontic assessment so they can understand you know what you're doing. They're not just going to tell you this is what you need to do. They're encouraging you to come up with the treatment plan and then put it forward. But I suppose to answer the question, the best bit I've taken from the course is actually coming up with how to do an orthodontic assessment, because it basically lets you outline the plan and then come up with a treatment plan that you can go ahead with. This course has impacted my practice, basically being able to really well treatment plan and then go to patients really confidently and say, this is what I think the options are and this is what I think would maybe be more suitable for you based on what you've told me. And then actually to just get started with the treatment, because you basically learn an indirect setup, so you're not having to worry about bonding the brackets on. You get the brackets back in a stent and then you bond them onto the teeth, and from then you can just worry about tying in the wires. You don't need to worry about placing the brackets as such, and that just makes treatment really seamless. A specific patient case that I can think of, a fellow dentist that's one of my friends came to me and was thinking about orthodontics, and we were actually able to come up with a treatment plan that allowed me to extract 4 premolars, 1 in each quadrant, and then from then basically get on with treatment. All the teeth are pretty much lined up now and we're just focusing on closing the spaces. Since implementing orthodontics, I would say that revenue has gone up. Since I started, I've done about 15 fixed cases, and it's quite good as well. Like at the start, you don't need to charge us that much just as you're learning, but as you get more confident, then you can obviously start to charge more, basically based off your experience. I would say to any colleagues that are on the fence about enrolling in this programme is that it's a great programme. I would definitely recommend it. You really have a massive comfort blanket with the open forum with Andrew and Peter, and also you've got Nathan and Parm that help on the course. All 4 of them have amazing experience and are very good at kind of getting that experience over to you when you're talking about cases in a way that you'll understand. And if you are interested in orthodontics, it's a really good comfort blanket to basically come in, especially like I was mentioning about the indirect setup. You don't need to worry about placing the brackets, which I was worried about before I came onto the course. They'll give you the brackets in a stent, and then that allows you to bond it up, and you just really need to focus on the wires from that point on.